We have a ring, but that's the pendant.
Yeah.
I'm Mary Harrison. I'm 62, and I live in Benbrook, Texas. I'm semi-retired, and I own a bead store. We make jewelry for people. We do an awful lot of repairs. It involves a lot of sitting and then standing. 20 years ago, I went bowling with my mother, and I tore my meniscus at the same time. It never really healed. My left knee kept having to compensate for my right knee, and it started hurting. It just got progressively worse and worse. There weren't very many activities I could do. If it involved walking, climbing steps, it was embarrassing. I did feel old.
She couldn't get around well, she couldn't work well, she couldn't function at the level that she wanted to function at. I took x-rays of Miss Harrison's knees. Both her knees were bothering her significantly. Found out that both her knees have osteoarthritis. For her, they were end stage, meaning that they were bone on bone. We discussed doing a staged knee replacement, meaning we start with the right knee replacement, followed by a left at another date.
He was very adamant to say that he doesn't want to hurt any kind of soft tissue if he doesn't have to, and that the robot helped him to do that.
I use robotics for all my knee replacements. There's less soft tissue trauma, and in my experience, when there's less soft tissue trauma, you typically have less pain post-operatively. You can also dial in the angles and dial in your rotation, how you place the components. Furthermore, in live time, you can check the balance and stability of the knee.
The left knee was done 4 months after the right knee. All through my recovery, everybody would say, "You're doing so great." Other patients would kind of look over and say, "I can't do that yet." And, I felt kind of like a superstar. I was driving at the end of 2 weeks, off of all pain meds. My life is 100% better than it was. Everybody noticed that I wasn't limping, that I wasn't so horribly bow-legged, that I could get up out of the chair and walk right away. Now that I have new knees, walking the dogs is a lot easier. I don't have to wait for them to come to me to put on the harness. Texas Health at Clear Fork made it easy to get registered, get everything taken care of. They had everything clearly established, what you needed to do, and they put your mind at ease at every step.
Texas Health Clear Fork is a large subspecialty hospital focused on hip and knee care. There's a multidisciplinary team that work really well together in caring for patients, where we have excellent culture in caring for patients. We also focus on patients getting well.
The biggest problem I have with my future is trying to decide what I want to do first. I want to retire, and then I want to travel more. And I definitely want to take a lot of walking tours, and I want to go up and down a lot of steps. Being pain-free is pretty cool.